Hello and welcome to this webinar focused on mental health, stigma and discrimination, which is part of an ongoing series of webinars organised by United for Global Mental Health, Lancet Psychiatry, the Mental Health Innovation Network, MHPSS.net and the Global Mental Health Action Network. This session has been organised in partnership with Time to Change Global, a programme which challenges mental health stigma and discrimination in Ghana, Nigeria, Kenya, Uganda and India. Please use the hashtag mental health for all when tweeting about this webinar, and we really want to encourage you to tweet throughout this event. This session will last 45 minutes and is being recorded. Can you please send any questions to webinars@unitedgmh.org or write them in the chat box, and we will have time for a short 10-minute Q&A session for any questions you have for the panel at the end. My name is Sue Baker and I'm from the Time to Change Global programme, which is a partnership between UK mental health charities Mind and Rethink Mental Illness, International Disability Organisation CBM, and 5 country-level partners in Ghana, India, Nigeria, Kenya and Uganda. I have the honour of chairing today's session and interviewing the panel of experts who are Esenam Drah, who's a mental health advocate and champion working to address stigma and discrimination with the Mental Health Society of Ghana and in many other ways too. Charlene Sunkel, who doesn't have her camera on but is attending, who is the founder and chief exec of the Global Mental Health Peer Network and co-editor of the current Lancet Commission on Stigma and Discrimination. Petra, who's a research fellow at the Institute of Psychiatry, Psychology and Neuroscience, King's College London, and is also a coordinator of a large anti-stigma programme focused in low and middle income countries, which is called the Indigo Partnership. And finally, Louise Brookes, who's a previous young champion and regional coordinator, and now children and young people's consultant for the Time to Change campaign in England. So globally, too many people face discrimination, exclusion, and other restrictions on their human rights because of their mental health problems, as well as restrictions in accessing quality and affordable mental health care when it's needed. Many people are excluded by families, friends, communities, employers, and schools. Such exclusion restricts their right to education, work and employment, amongst other things. Many people experience exploitation and abuse, violence, inhumane treatment, and even torture because they have a mental health problem. Stigma is a major cause of this wide-scale discrimination, and it keeps those of us with mental health problems shut out from communities. A previous survey amongst people supporting the Time to Change programme in England found that 2/3 of people said that stigma and discrimination was as bad, if not worse, than the symptoms of the mental health problems themselves. So this session today is about highlighting some of the realities of stigma and discrimination faced by those of us with lived experience of mental health problems around the world, and share some of the peer-led approaches being taken to tackle stigma and discrimination. We'd also like to explore some of the early findings from the latest stigma research undertaken to inform approaches to stigma attached to the current pandemic, to COVID-19. So without further ado, Esenam, if you're ready for the first question, we're going to get into the interviews with our wonderful panel. So Essie, we agreed you'd prefer to be called Essie. So Essie, can you tell us more about your participation as a champion in the MESOG project in Ghana, and how this has helped you tackle stigma and discrimination in your own community, but also your experiences of stigma and discrimination itself, and how this has helped your work?
Okay, so I was working as a teacher in a school last year in October, and the job was very stressful. I dozed off at 2 meetings, and a member of management saw me dozing off, and she asked why I was always dozing off, and I told her that I had bipolar disorder and I wasn't getting enough sleep. And she told the other members of management, and 24 hours later I got fired from my job. But the reason why I think it didn't affect me, the stigmatization didn't affect me that much, was because I'd been trained as a champion in March last year. And because of the training I received, I realized that I did not need to feel worthless or isolated because I have a mental health condition. And so when I was trained last year in March, we began doing social contact events. Social contact events are where we go and talk to people in the general public about mental health, creating awareness, giving them materials and souvenirs that have information about mental health on it, and just educating people so that they realize that mental health problems are real. They can affect anyone at any point in time. So because of all that training I had received, I felt very, very much empowered to even start my own YouTube channel on bipolar disorder, where I talk more about my lived experience. So after getting fired, it didn't change who I was, it rather changed my personality, and the training really helped me too.
Sorry, that's me. You've got a very big. You're busy on YouTube as well, aren't you? Sharing your story, and I think you're also a member of the Global Mental Health Peer Network too.
I recently got appointed in June as a member of the the Global Mental Health Peer Network. It's a very long, yes. So I got appointed as an executive committee member for Ghana, and it has given me a new family, a new sense of belonging. And I enjoy the Africa team I belong to. We have meetings from time to time, and we are planning on a lot of projects. Yes.
Brilliant. That's really good to hear. And we'll hopefully hear a bit more about that later. Thank you. Charlene, I wonder if I could ask you your first question on the panel, which is actually about the Global Mental Health Peer Network. Could you tell us what kind of activities the network are involved in and how people are involved in advocating for the rights of people with lived experience?
Thanks, Sue. Yes, I actually want to start by saying that meaningful and authentic involvement and inclusion of people with lived experience is a human right. And it's also so noted in international human rights instruments, for example, the UN Convention on the Rights of Persons with Disabilities. So the peer network, the Global Mental Health Peer Network, very long name, is an international lived experience organization, and it basically consists of two key structures, which is the Regional Executive Committee based on the 6 WH World Regions, and Country Executive Committee, representation of specific countries, of which Esenam is part of. And currently we have 53 lived experience representatives from across 31 countries, and they are our global mental health leaders. So the peer network also focused basically on two main areas, which is lived experience leadership development, and to create a sophisticated platform to share lived experiences, perspectives, and recovery narratives. So through the peer networks, the members are empowered. They provide peer support to one another, and they share their activities and learning, and they also collaborate in various advocacy initiatives as well as campaigns. I think what's amazing is what makes the peer network a valuable and powerful source of lived experience expertise is, of course, its diversity in terms of lived experience representation from different countries, people with different backgrounds, age, races, skills, and it is just a powerful source. And what they do basically get involved in is to participate in both local and international engagement platforms, that would be conferences, workshops, and so on, where they provide their lived experience perspectives. They're also often involved in the review and drafting of local and international policies and strategic documents. But most importantly, they provide recommendations to guide policy and practice. And I think just to my final point is for them to provide perspectives through lived experiences and their recovery journey it gives that valuable insight into what actually is experienced in practice at grassroots level.
Thank you, Charlene. That was really, really helpful and fantastic to hear about the work of all of the members. Really inspiring. Thank you very much. So Petra, I wonder if I could ask you, as a lead author of the COVID-19 Stigma Rapid Review research, which is looking at cross-sectoral learning and evidence, can you share the emerging recommendations on reducing stigma and discrimination in relation to COVID-19, please?
Yes, thank you very much, Sue. So stigma in relation to COVID-19 has the potential to be a global phenomenon that could compound the impact of the virus. So specifically, due to the stigma, people affected by COVID-19 could be harmed twice over. Firstly, by the direct impacts of the virus and being unwell, but also secondly, because of being shunned and mistreated by others. So in view of all these negative potential impacts of stigma, we set out to conduct a rapid review to produce practical recommendations for stigma reduction in relation to COVID-19 based on current best available evidence. And this work resulted in some recommendations that we group within 5 domains. And I'll just give you a quick outline of what these recommendations are. So first, we make some recommendations regarding the language, terminology and words that are used when referring to COVID-19 or when talking about people who are affected by the virus. Secondly, we made some further recommendations specifically in terms of providing clear guidelines for media and journalists that emphasize the need to provide really balanced information, to avoid sensationalist headlines or sensationalist language, and particularly to involve people who are affected by COVID-19 themselves in the reporting around the illness, for instance, through including personal accounts of the illness and its impacts within other news reporting. Thirdly, we make recommendations to provide stigma reduction interventions on a general population level. And these efforts need to go beyond simply providing factual information, and instead they should include approaches that strategically aim to change commonly held beliefs and to shape knowledge, to correct myths, counteract rumors and stereotypes, counteract biases and any other public misconceptions that there might be, and also change attitudes around the illness. Fourthly, we recommend targeted anti-stigma interventions as well, aimed at particular groups that might be more likely to experience stigma in relation to COVID-19. So this would be people who are unwell themselves, or perhaps their family members, healthcare workers, social care workers, and other frontline workers. And as a final set of recommendations, we recommend that interventions should be designed and delivered in consultation with local organizations and community leaders. And this should be done to make sure that there's legitimacy within these stigma reduction activities by ensuring that the messages and the initiatives that are provided are contextualized with local knowledge, and that local voices and local appropriate imagery is used. And also within this aspect, it's really important to try to involve people who are affected by COVID-19 themselves. So bringing people who have lived experience of the illness within that community.
Thank you so much, Petra. And that was across a large number of stigmatized health issues and previous pandemics, and that includes learning from the mental health sector as well. Thank you. Thank you very much for that summary, and thank you for allowing us to be able to explore some of those early findings with you. And Louise, I wonder if we could turn to you now for your first question. Could you tell us, the audience here today, more about your journey to support other young people to tackle stigma and discrimination, and why it matters so much to have young people working together as peers?
Mm-hmm. Hello everyone, I'm Louise, and I joined Time to Change England as a young champion back in 2013 when I graduated from university. Being a young champion is all about sharing your own personal experience of mental health problems and discrimination and stigma that I faced in schools, colleges and other youth organisations, and I did that for a number of years. And then in 2017 I became the West Midlands Regional Coordinator, where I would support other young people to share their stories in schools and youth organisations. I think my previous experience of having been in their position was paramount, and it really helped me to empathise and support them in their role, as I kind of knew a bit about what they were doing and experiencing. And young people, for me, I think it's really important for us all to work together, and it's really, for me, about collaboration and shared experience and ideas. I've often found, for me personally and for the other young people I've worked with, that young people often feel more comfortable talking to people of a similar age, and often find it easier to open up to peers. So I think this was sort of really important, to have others sharing their experience on the programme with each other before taking that out to schools and youth organisations. And as well, it's about having somebody in your corner, which the hashtag In Your Corner campaign is something that Time to Change set up. And as well, having people to sort of check out the risks with beforehand, a group of peers that can maybe let you know or help you with maybe what feels okay to share at the time and maybe what doesn't. So to just have a bit of a practice room really, and a support there from people of a similar age and that have been through similar experiences. I think that shared understanding is probably the most important thing.
Thank you, Louise. That's so vital, isn't it, that we work together as peers on that. That's brilliant. And actually, on that topic, Esenam, we're going to come back to you with following this discussion about the importance of thinking about the risks of speaking out publicly and preparing for that. So, as we know, that it can be very challenging to speak so publicly about your own mental health as well as stigma and discrimination. How have you prepared yourself to do that? And you've done that very publicly in Ghana and globally as well. And what kind of support did you find most helpful?
Okay, first of all, I was trained as a champion. We did something we call spokesperson's training, where we are taught how to handle difficult questions. Let's say you get interviewed on radio, television, or online, how to handle difficult questions, how to deal with triggering content. So in that training, I was taught all the skills I need to be able to go public about my mental health advocacy. And also my project coordinator, Abena Koko, she's like a mentor to me. She had been doing mental health advocacy years before I started. So she offers me help most of the time. She gives me inspiration. So those are some of the ways that I have prepared myself to be able to go public with it, because in Africa here, even now that I've decided to start my YouTube channel, some of my extended family is not happy that I'm going public about saying that I have a mental health condition. So I'm glad Time to Change prepared me for all this. So I don't like let it get me down. Yeah.
Thank you so much, Esenam. It's so important that you've got the right support wrapped around you when you're speaking so publicly and in the first really public sort of social marketing campaigns about mental health stigma. And you've been incredible in being courageous enough to share your story. So thank you so much for doing that and supporting other people on their journey too. You're welcome. Charlene, your next question is, obviously I think you're pretty well known as the founder and chief exec of the Global Mental Health Peer Network. What do you think are the benefits of peer-led approaches, both locally, nationally and globally? If you wouldn't mind, the next few answers are going to need to be relatively brief.
Of course. I think, first of all, I think lived experience voices have been silenced for decades and even still today. And stigma and discrimination are main factors in denying people the opportunity to speak out and also to be involved meaningfully and as well as authentically. But I have seen in my more than 15 years career, there is really, and especially now, growing recognition of people, the recognition for the value of lived experience involvement, but also the importance of lived experience to be at the center of policy and practice. I think, again, referring to international human rights instruments, it specifically also refers to stigma and discrimination-free societies. Just to mention a bit about the evidence of the benefits, we've seen there's evidence on peer-to-peer support, that it is as effective as other professions in the field. It improves recovery, reduces hospitalization, reduce coercion, and it generates hope and purpose, both sides, for the person who receives peer support services, but also providing it. And then advocacy, people with lived experience have unique expertise by experience in navigating system, and not only the mental health or health system, but all societal systems, including education and whatnot. And having experience also where human rights violations are ingrained within some of these systems. And also have that in-depth knowledge of services that are actually leading to recovery, and also the knowledge of what is not working or what doesn't really lead to recovery. And just finally, also important peer-led approach is involvement in awareness, specifically also stigma reduction, by sharing recovery stories. We all know there's evidence that that is one of the most effective methods, because it creates that human element and not a label. It is seeing the person and not the disorder.
Thank you, Charlene. Thank you. And thank you to your feathered friends' contributions as well. So I'm going to move on to Petra now, just mindful of time in your responses, please, Petra and Louise. So in terms of the Indigo programme that we mentioned earlier, can you tell us more about the importance of local, cultural, contextual adaptations of Western evidence-based principles in addressing stigma, and why leadership matters when it comes to stigma interventions and planning?
Absolutely, thank you. So Indigo stands for the International Study of Discrimination and Stigma Outcomes. It's an international research network that's coordinated from King's College London. It's been active for over a decade now, and the current focus of our work is on stigma reduction interventions specifically, with a focus on low and middle income country settings. So we're currently working on a project that's called the Indigo Partnership, with colleagues in 7 sites in 5 countries, in India, China, Nepal, Ethiopia, and Tunisia. And currently, most evidence regarding effective stigma reduction comes from high income settings. So the core idea with the Indigo Partnership is to take that current evidence base and formulate stigma reduction interventions from that, but to ensure that these are culturally and contextually adapted to the specific settings where we conduct the work. And our research sites are intentionally quite varied, so there's differences in terms of culture and beliefs, and also healthcare systems between the sites. And our challenge is to formulate flexible intervention templates that can be adapted to these quite different contexts. And we know that although stigma will be an issue probably most likely across all these settings, these specific ways in which stigma manifests through particular concerns, fears, assumptions, behaviors, etc., that's what's likely to be different in these different settings. And that's what the interventions need to be tailored to. And this is also where local leadership and expertise is absolutely essential, and why our current project is really focused on this idea of generating a true partnership with our local collaborators, who then in turn are leading their local research teams and involving local key stakeholders in the work. And this is because we believe that it would not only be challenging, but probably unhelpful and maybe even inappropriate to expect that we could generate an in-depth understanding of the local nuances of stigma experiences without working really closely with collaborators who are familiar with the context in question and who have insights into the local culture and the social dynamics, the beliefs, the language that's used, etc. So the partnership work includes a really large component that's dedicated specifically to explore these local insights and then use that to adapt the interventions to work in the local context. And what we also do is make sure that we have research instruments that have been adapted to the local setting. So not only using translated versions of existing psychometrically sound measurements and research questionnaires, but making sure that the language within them is appropriate to the setting, that any examples or scenarios that are provided have been culturally adapted, so that we can be confident that we're actually measuring stigma in a meaningful way. And also here, having local leadership to help us with that process is really important.
Thank you so much. Thank you, Petra. Absolutely. So local contextualization, led locally with local insights, led by communities for communities. Thank you very much for sharing that. And I'm going to ask the last question for the panel. Louise, I'm sorry you've got the last question, but I know it's I know you'll give a great response to end the panel question answer session. So having worked with schools across England to address stigma and discrimination using what's called the whole school approach, how have you helped embed this focus within a school instead of being a dive bomb in, dive bomb out, one-off activity?
So when we deliver sort of our stigma and discrimination to schools and youth organisations, we ask that it's a group of schools working together sort of in the local community rather than just a single school. So we'll ask schools and organisations in the same area if they would come together to complete the training, so we can deliver the message to a larger group of people, and then we ask them to work together throughout the training and then maybe afterwards as well. The training that we do includes something that we call an action planning section. So after participants have heard about what other campaigns do, and we've given examples of other campaigns, we then ask what they might be able to do in their school or college or organisation, and even ask them how they would do this and give them time during the session to plan what they might do. And then following our training, some organisations and schools have then sent examples back to us of what they've done. So they've held stalls, they've spoken to each other. One group of sixth formers then went to speak to pupils in their local primary school about the transition from primary school to high school, as they know that can be quite difficult for pupils' mental health. So I think that's sort of really important to show how the message has kind of gone forward between people rather than just in single schools. And as well, I think it's really important to mention that our training is targeted to all school staff, so head teachers, senior management teams, teachers, support staff, admin, kind of lunchtime staff, all of the staff, not just kind of senior management or teachers. We think it's really important for everybody to get involved, because I think we all agree, and it's sort of really important for me. I think, you know, talking about mental health for me is everybody's responsibility. So yeah, and we went to one school and asked if they would like support for the coming year, and they told us, you know, thank you very much, but we've already planned out our mental health workshops for this year. So hopefully I think, you know, using some of our resources, they've then taken that forward as their own plan. And I think finally, the big thing for me was when I had the privilege of working with one young champion to share their story at a national schools conference. One of the teachers there came up to speak to us at the end and said, hearing your story has really helped me realise and think about how I might talk to my own child, because they've been struggling with their own mental health, and now I understand a bit more about it. So by having and hearing all these different experiences and all of these kind of joint workings and people working with stigma and discrimination sort of outside of the Time to Change programme after their training, I think it really shows that hopefully the campaign and the training has really become sustainable.
Thank you so much, Louise, and it's brilliant to hear that feedback from a teacher as a parent as well, and a school that's embedded it in their, action planning for the year ahead. If only every school in the world had mental health and mental health stigma routinely as part of the school curriculum. Thank you so much. That's brilliant to hear about. I'm going to move us on to the next section, where we've got probably about 7 or 8 minutes for questions coming in from the audience, and thank you to everybody that's dialed in today. I'm going to take a couple of questions first, and then let's see what else has come in. But first of all, I've got a question from Matrika from Nepal. And I'm going to, Essie, I'm going to ask you to respond to this because of your experience in the Ghana social marketing campaign, where we found that insight with the local community audience was very much associating mental health to madness and dangerousness. So the question is, there is a myth that persons with a mental health condition are dangerous for themselves as well as for others. How can we omit these myths? Essie, what would you say to that? What work have you been doing to overcome the myth of dangerousness?
Well, I think that people have these misconceptions because they do not have enough knowledge about some of these conditions. I believe strongly that if they are educated on mental health and mental health conditions, they will come to understand that it's not the fact that you have a mental health condition doesn't mean that you are dangerous. For me as a person, I decided to Google one time famous people in the world who have mental health conditions, and I was surprised as to the number of results I got. And I realized that, okay, if all these people are very successful in their work, for example, the owner and founder of CNN, Ted Turner, he has been able to become so rich and successful in his field, even though he has bipolar disorder. So if people educate themselves more and read more about these conditions, they'll realize that, oh, okay, having a mental health condition doesn't mean you are dangerous at all. They will realize that also mental health conditions are very, very, very common. That's what I think. So we just need to keep doing a lot more of the campaigns. If people see that there are real people out there who have conditions, they wouldn't see it as a very scary thing at all. They won't look at it that way. Not anymore. Yes. And I know it will take time. It will not just be like one day. We just need to keep pushing the message forward over and over again. It will take some time for it to happen. Yeah.
Thank you, Essie. Yeah, it's not going to happen overnight. In the campaign in England, we said it's the work of a generation to overcome this discrimination and to build knowledge and understanding. But having people share their lived experience is definitely one of the most evidence-based ways to tackle some of those myths. Thank you so much, Essie, for sharing that. Charlene, I'm going to put this question to you, if you don't mind answering this. This is also from Matrika. There are still discriminatory laws related to persons with a mental health condition, which are prevalent in my country of Nepal. How can we eradicate those discriminatory laws? Are there any best examples to use in our context?
Yes. I often think that we focus so much on educating people with lived experience about human rights, but I think we also need to swing it around and teach other people about human rights and these human rights instruments. I think the WHO Quality Rights is one good way to implement, and I think if you have a strong lived experience voice, you can make a lot of change and lobby for these laws to be changed, and also to use lived experience examples of how it impacted that person, these discriminatory laws.
Thank you, Charlene. Yes, even some of the language in the laws, let alone the content of the laws, is stigmatizing and discriminatory, talking about imbeciles or defectives or terrible language. That all needs updating the actual laws, let alone the title of them. Petra, did you have anything you wanted to add to that, to Charlene's comment?
Nothing in particular. I think it was a very comprehensive answer, but I also think it's important to not be overwhelmed by these structural changes that might be needed, and think about how the change can be thought of in feasible little chunks of work, and yeah, not to be overwhelmed by the fact that we really need to do something on a structural level as well as change things on an individual level, but then to think that these work in sync as well. So sometimes you can really create momentum by focusing on changes within individuals, within communities, and that can then help to drive political action. But I think we can't rely on that alone. So it needs to be a multi-pronged approach.
Thank you so much, Petra. We found that in the England campaign as well, that driving sort of public momentum and better understanding and improved attitudes and behaviours, but you've also got to, as well as work with individuals in the community to create a kind of tipping point, you have to work with the structural discrimination as well. I've got a question that's come in. Sorry, I'm just going to mute while there's busy here. I've also got a question from Vaya Bhavi, who's from India, who says, as someone just starting out on mental health advocacy in their local community, and it's great, thank you very much for joining, do you have any advice for me? So someone's just starting out on their journey to do mental health advocacy work in their community. Where would they start first? And we've literally got a minute for that response. So in 30 seconds, could we hear from Louise and then Essie again? What would be your tip?
For me, I would say pick maybe one or 2 points that you're really passionate about, and you think, you know, you've got the experience in and kind of your story and your passions to be able to sort of really embed yourself and your ideas in what you want to do and what you talk about in your local community. I think for me the most important part about campaigning is enjoying it, and that comes across then, and can tell that you're really passionate about making a change for what you're talking about. So yeah, find something that sort of really sparks your interest and you're really passionate about to talk about in your local community to try and make that change and that difference.
Thank you, Louise. And Essie, if I could ask for a quick response from you, please. Where would you go first?
Okay. Time to Change Global has just launched a toolkit that I think will really help if he or she goes to check it out on our website, www.timetochange.org.uk. It has evaluation on case studies and stuff like that. It will really, really help you. And also, don't give up. Like, it's not going to be easy. People will not just accept what you are saying at the beginning. You just need to keep pushing on and on and on. People will say a lot of discouraging things to you. I have people sending me messages on social media that I just have to keep my condition to myself. Why am I going public about it? But I listen to, I think about the fact that the WHO says that 1 in 4 people will be diagnosed with a mental illness in their lifetime. They will experience it. So I don't know whether it's going to happen to someone, like someone's loved one, friend, or family member today or tomorrow. I just want everybody to be prepared. So that is my motivation, that I need to keep doing it because someday someone will experience this and they need to be prepared. I believe if some of my friends and family members had the kind of knowledge and information I have today, they would have been able to support me better, and I would not have struggled in my road to recovery and my mental health journey, because I really, really struggled. So I just don't want people to go through that. So let that be your motivation every day.
Essie, thank you so much. Have you got one thing that you want the audience to take away with them? Just, I think we've got about 20 seconds each to give your last point that you want people to remember.
I just want to say that stigmatization is real. I never knew it was a real thing, and you never know how much it really hurts till you are affected. So I just think everybody should brace themselves by getting more knowledge about mental health, because everybody has mental health. Once you have a brain, you have mental health, and you never know when you can get stigmatized. I had never been stigmatized before until that incident, and I felt it was something far away from me, but it can happen to you or someone you know. So just get informed all the time and support people you know who have mental health conditions by loving them, showing them love all the time, encouraging them so that they would not be down all the time. Because of the kind of support system I have, my peer support, even some of the champions in my like my group, when they found out that I had been fired from my job, all of them were just encouraging me, like, you are not alone in this. So everybody should just try and find your support system too. That'll work for you.
Thank you. Try not to do it alone. Thank you. And thank you, Essie. That's brilliant. I'm really sorry. We're going to have 10 seconds from each panelist. So Louise, can you just give me one sentence that you want people to take away, one message?
Yeah, for me, it would be that it's everybody's responsibility to talk about mental health, to try and tackle the stigma and discrimination, because the more we talk about it, the more the stigma reduces, hopefully. And yeah, it's paramount. Just keep talking about it.
Thank you so much. Petra, just 10 seconds.
From an academic point of view, I think it's really important to evaluate stigma reduction strategies so we can learn as much as possible and then benefit from that learning and keep on developing our effective strategies.
Thank you so much. And Charlene, just 10-20 seconds, please.
Okay, I think first, just a quick one is, I think to create safe spaces for people to talk about mental health and also to develop, diverse lived experience leadership, because that will ultimately eliminate stigma at the end of the day.
Brilliant. Thank you for that's the final point. Thank you very much. Now, just before we do the closing, we're going to do a quick poll. So we're going to ask you to the audience to instantly react. Please don't overthink this. We've only got a minute, if that, left. So if the technology works, we're going to have a couple of poll questions for you to answer. I'm going to ask you to instinctively answer. So this session has helped me consider new ways of including people with lived experience in addressing stigma and discrimination. Could you just answer that in the next 20 seconds? Okay, and then if we've got time for a second question, which we may or may not have time for, I'll leave it up to the organiser. Yes, we have. There needs to be more focus on addressing mental health stigma and discrimination in my country that is context specific. Could you just give a very quick reaction to that, please? We're almost out of time. Brilliant, and we'll get the results. Okay, strongly agree, there needs to be more focus. About 2/3, about a third agree, not many people disagree. Right, so lots of people need more focus on stigma and discrimination within their context, and the answer to the first one, hopefully now as well. Strongly agree. Okay, great. So most people found it helpful to one degree or another. That's fantastic. Thank you so much. So finally, thank you to panelists Esenam, Louise, Charlene and Petra. Thank you so much for joining us and sharing your experiences. Thank you to the audience too for joining and for the questions. Thank you very much. Please do carry on the discussion on social media. There's this recording of this session will go up on the United website, which is unitedgmh.org, in the news section very soon. Don't forget the Time to Change Global Toolkit, which you can find on the Time to Change Global website. And the next session, which will be at the same time in 2 weeks on September the 29th, which will be all ahead of World Mental Health Day. So it's about campaigns and activity for the really big moment that we have in mental health around the world, where you're going to hear from the communications team from the World Health Organization, the World Federation for Mental Health, and from campaigners. And you can register for that at unitedgmh.org on the website and submit your questions in advance of the session. So finally, just for me to say thank you very much for joining and wishing you a pleasant day or evening ahead. Thank you. Goodbye.
Goodbye. Bye.